Madeira Beach is located south of Reddington Beach from 156th Avenue along Gulf Boulevard to Johns Pass. It is surrounded by the Gulf of Mexico and Bogosiega Bay. Area code 33708 has a total of 1.03 square miles and total residents of 4,283 at the last census. Historical overview. In the summer of 1848, two pioneers, Joseph Silva and John Levique, settled along Bogosiega Bay. They sailed to New Orleans to sell cargo, and on the way home they encountered a bad storm. Upon arrival home, John Levique attempted to find the familiar entrance into Bogosiega Bay, but found a new opening. On September 27, 1848, they navigated through an inlet between Treasure Island and Madeira Beach that is now known as Johns Pass. In 1914, development began in Madeira Beach by Noel Mitchell. In 1921, a major hurricane hit Madeira Beach, causing severe destruction. In 1926, Army veteran David Welch purchased land from Noel Mitchell and is responsible for the first causeway and bridge to open, allowing transportation between Treasure Island and Madeira Beach. In 1947, development began with small cottages and housing. In the 1950s, subdivisions began, and today there are hotels, condominiums, and housing located along the coast. Tourism increases the city's population 11.9% during the months of November to April. Madeira Beach is much smaller in comparison to surrounding communities. Along Madeira Beach, there are many hotels and condos. There are only two grocery stores, a Winn-Dixie and a Publix, and one church, which is non-denominational, called Church by the Sea. There are two schools located in the area, Madeira Elementary and Madeira Middle. The closest college is SPC, and that is the Seminole campus. There is a public library, and they do not offer low-income housing. They do offer assistance programs such as Section 8, low-cost rent-to-own, and single mother programs.
Madeira Beach has an aging population with over 55% of its residents over age 50. This population is at an increased risk for developing chronic diseases as evidenced by area mortality rates of heart disease and cancer. Van Morik identified that dyspnea and exercise intolerance are common in the elderly and one of the top causes for heart failure. He also identified that a simple questionnaire sent to target populations can identify symptoms which might indicate early onset of certain chronic diseases. By reaching out to these patients and identifying symptoms and offering them appointments, improvements could be made in morbidity, mortality, and quality of life. The increasing trend among elderly population is an increase in the transmission of sexually transmitted diseases. Minucci cites an increase in availability of medication to address erectile dysfunction in elderly men might be contributing to the increase in STDs, and a lack of education among this population may be leaving them vulnerable to further exposure. Each of these concerns alludes to a need for increased presence of available primary care programs within Madeira Beach to provide proper education and screening. Madeira Beach has very few primary care resources within the community. Healthy People 2020 identifies its cancer goal to reduce the number of new cases, illnesses, disabilities, and death caused by cancer. Cancer is one of the leading causes of death within this community. Through primary education, screening, and early detection, the number of new cases, illnesses, disabilities, and death can be reduced. In addition, their cardiovascular goals include health and quality of life through early prevention, detection, and treatment for risk factors associated with heart disease and stroke, which is the leading cause of death within Madeira Beach. There is a dire need for improved primary care to assess cardiovascular health, identify and treat risk factors, and manage treatment to decrease acute illness, exacerbations, and death related to heart disease. Lastly, goals related to sexually transmitted diseases are to promote healthy sexual behaviors, strengthen community capacity, and increase quality of preventive services. STDs are the most prevalent communicable disease within this community, and research has shown that access to health care is essential for education, prevention, and early detection. There are multiple acute care facilities within 3 to 6 miles of Madeira Beach. Statistics show that a majority of the residents either have the income to support healthcare access or would be eligible for federal and state assistance. The major disparity for this community is access to convenient primary care.
Throughout Madeira Beach, adequacy of environmental resources does fall short in certain aspects, and one in particular is that there is no police department. The fire department is located at 300 Municipal Drive and offers programs such as the city's management plan, evacuation routes, bicycle safety, traffic regulations, home safety, and water safety. There are a few parks located on Madeira Beach, including Madeira Beach Access, Tom and Kitty Stewart Park, and Archbold Beach Park. On the beaches, recycling and trash receptacles are available to keep the beaches clean and safe to visitors and the ocean. Current construction that can cause issues for residents and visitors include a new CVS that will be located across from Archbold Park. There is also a municipal complex that is currently under construction, however, it is still open to the community. Stormwater runoff drainage systems are being updated, which can also cause issues for the community. Another issue is parking, which is always difficult. There are bike trails located along Gulf Boulevard, however, there are no sidewalks throughout neighborhoods, which can be a huge safety concern for pedestrians.
The City of Madeira Beach's website provides a wealth of public information regarding city officials, budget information, agendas, meeting notices, and meeting minutes. From looking through the meeting minutes, it appears that there is little input from the community at board meetings, with exception to prior board members who have firsthand knowledge of the issues within the city. Within the last 2 years, there has been a great deal of input and concern noted at the commissioner meetings from prior members about the financial expenditures of the current board, namely the redevelopment of Rock Park and the municipal complex. These objections have been presented in the light of the current board's approval of a $10.3 million project to redevelop Rock Park and the municipal complex. The concern is that $5.9 million of this money will come from the city's emergency fund, reducing it by over half to a projected $3.4 million in 2015. Considering that Madeira Beach is a coastal community and vulnerable to natural disasters, the depletion of this fund appears to be an extremely valid concern for the city and its residents, and one which should garner more attention from the community.
Based on the community assessment of Madeira Beach, there are 6 overall community needs perceived by the community nurse. The first issue is that there are no primary care clinics, which can be a huge issue for the elderly population over 50, which accounts for 50% of the total population in Madeira Beach. The second issue is handicap accessibility. On public transportation, such as the buses, there are no handicap accessibility offered. At Johns Pass, there is no handicap accessibility on the boardwalk. However, there is an elevator that allows for transportation from the first to the second floor for shopping. The third community need is that there is no police station, which is attributed to a higher crime rate. In Madeira Beach, there is a 52% higher crime rate than the Florida average. Another issue is the prevalence of STDs, which is attributed to the elderly population and the spring breakers. The fifth issue is the sewage, which for the stormwater runoff updates can be an issue in regards to cleanliness for the community. And the last issue is parking. For an area that encompasses 1.03 square miles that has many stores also located on the beach, it leaves little room for parking lots.
Madeira Beach is a community rooted in history and tradition. The city thrives on revenue from tourism and the taxes paid by its residents. The city has done a wonderful job in recent years of making improvements to sustain the growing demands of its tourist population. However, it needs to make improvements regarding primary care for its resident community. Madeira Beach has an aging population with leading causes of death from heart disease and cancer. Sexually transmitted diseases have been documented among the most prevalent communicable diseases within the community. Research has shown that education, preventative screening, and early detection provides better patient outcomes for each of these areas. The General Medical Services Contract is a project within the United Kingdom which provides pay for performance incentives for primary care providers who provide targeting programs for chronic illnesses. These programs screen at-risk populations for chronic conditions and provides no less than annual follow-ups in order to properly manage diagnosed conditions and avoid exacerbations. The City of Madeira Beach needs to take steps to provide incentives for primary care practitioners to locate there, as well as work with these practitioners to organize community clinics and screenings. The City of Madeira Beach takes great pride in honoring those who have provided sacrifices for the community and our country. Ultimately, the city honors its residents and visitors by providing the resources necessary to promote good health for generations to come.